Hello guys, today we are going to start a new chapter of Dhingra, that is chapter 1 of anatomy of ear. Okay, by this I will take 20 minutes or less than 20 minutes and you will be able to do your clinical MCQs and your uh, exam question SAQs and every single thing you will be able to correlate. So let's start with this external ear. Okay, let's see. This external ear, basically this ear is divided into three parts. What are the three parts? This is external ear, middle ear and your internal ear. This external ear is further divided into auricle and pinna, that is the outer part. Then we have the external acoustic canal, right? And then we have a tympanic membrane. This is the external ear. We are going to talk about first this external ear, right? Let's see about the external ear. So see in this diagram, we are divided external ear, auricle pinna, auricle or pinna, same thing. External acoustic canal and the tympanic membrane. And the middle ear and the internal ear is also known as labyrinth. Okay, remember this. Let's talk about the auricle and the pinna. This is the auricle and the pinna, the lateral surface of it. This auricle and the pinna, it is made up of yellow elastic cartilage which is covered with skin. This is the same line of Dhingra. Okay, except this lobule and the outer part of external acoustic canal. Okay, let's see. As I said, made up of yellow elastic cartilage except lobule and outer part of external acoustic canal, and the lateral surface is closely adherent, medial surface is slightly loose, not important. Let's check the elevations. The helix is the one elevation, anti-helix, this is the anti-helix, is the one elevation you can feel in your ears. And then we have a tragus, this is the tragus, this is the anti-tragus, the pointed areas. And then we have a crus of helix, this is the crus of helix, you can feel the crus of helix also in your ear. Then we have the spine of helix. What is the spine of helix? The spine of helix is this. Okay, great, clear. This is the lateral surface you can draw in the exam if they give it to you. So this is clear. Then we have some depression. This we talk about the elevation. Now we have some depression. What are the depressions? One depression is this concha. This is the concha. Then we have the triangular fossa. This is the concha. This is the triangular fossa. This is the thing. Concha and triangular fossa. Clear? So depressions, concha, scaphoid fossa and triangular fossa. And elevation, helix, anti-helix, tragus, anti-tragus, crus of helix, spine of helix. Clear? Now one thing, important thing is this incisura terminalis. This diagram you see, this is incisura terminalis. What is this incisura terminalis? It is basically the area between the tragus and the crus of the helix where there is no cartilage. There is no cartilage here. Otherwise whole auricle is covered by yellow cartilage, but here is no cartilage. So that's why we can do the incision here where there will be no cutting of the cartilage will happen. And it is used for your surgery procedure like endural approach and other for external acoustic canal or mastoid. Clear? This is incisura terminalis, area between the tragus and the crus of helix where there is no cartilage and used for endural approach and surgery of external acoustic canal and mastoid. I think it is clear. So we have the surgical use of pinna. Tragal cartilage is used for middle ear reconstruction, tragus part, and tympanoplasty and reconstruction. Conchal cartilage is for this. Lobular fat is for grafting. Basically grafting procedure it is used for your otologically surgery. It is used for this pinna. Great. Now let's talk about the external acoustic canal. This external acoustic canal, if you see, it is first of all it is not straight. Okay, this part is not straight, and it is 24 millimeter long. It is not straight and it is 24 millimeter long. Why it is not straight? Because the outer part, it is how it is directed. It is directed like this, upwards, backwards, and medially, not medially. It is laterally. Upwards, backwards and laterally, but inner part is just opposite. It is downwards, forwards and medially, right? So that's why if you go to the doctor or even in army exam, they check your ears. What they do, they pull your ears, they pull it upwards, backwards and laterally so they can see your tympanic membrane. Okay, if you want to see the tympanic membrane, you have to pull in that direction because it is not straight. Okay, the next thing about external acoustic canal, it has two parts, the cartilaginous part and the bony part. The cartilaginous part, this is the cartilaginous and this is the bone here, so that's why we're saying it's the bony part. The cartilaginous part is the outer 1/3 and the most part is inner 2/3. Outer 1/3, you might see some people have hairs in their ear that will be in the outer part. Hair follicles, sebaceous gland, your wax part. The wax is produced by which gland? Your ceruminous gland. Okay, and the bony part won't have these things at all. Okay, you see, skin is thick here in the outer part. Here will be present ceruminous gland, sebaceous gland. Special features is fishes of Santorini. Well, let's see what is fishes of Santorini. I have a diagram here. Let's see this diagram. This is the fissures of Santorini. It is present in the outer part. What does it do? It is basically, if there is a deficiency in these cartilage, what will happen? There will be communication, helps in communication with the parotid gland. So if there is a parotid gland infection, what will happen? The infection can spread from here to here, or it can spread from here to here, so vice versa. That is the fissures of Santorini that is present in the outer part. I think it is clear. Now let's go to the bony part. That is inner 2/3, it is 16 millimeter long. As I told you, skin will be thin, no hair, no sebaceous gland. One important thing is known as isthmus will be there. What is isthmus? See, as you see this diagram, there will be isthmus here. That is 6 millimeter laterally to this tympanic membrane. What does isthmus do? This narrowing, it helps to prevent any foreign body to go inside. You must have seen, like in children, what did they do? They put toys inside their ears or some pearls inside their ears. So this isthmus prevent it to go more deep. You might see in that what? That is the role of isthmus. Okay. Then we have an anterior recess here. What is anterior recess? Let's see this diagram. External acoustic canal, tympanic membrane. This is the anterior inferiorly. Will find this anterior recess. What does anterior recess helps in? So basically, it acts as a pool for discharge and debris for infection. So if any discharge and debris is there, the doctor can see in the anterior recess, they will find a pool there, poolage of this debris and will be there. One more thing is foramen of Husky in this bony part. Let's see what is foramen of Husky. As I told you, fissures of Santorini in the outer part. This foramen of Husky here. The same thing is it. Basically, parotid gland communication infection can spread. And it is basically present in children up to 4 years and may persist up to adults. Clear. This is the cartilaginous part and bony parts. In the table we have done each and everything in single detail. One more thing about external is the relations of it. Let's see the relation. Here what will be? There will be a middle cranial fossa on the superior part. Below will be what? Parotid gland. Here what it will be? Here you will find your temporomandibular joint will be present here. Temporomandibular joint. And on the posterior part you will find the mastoid ear cells and your facial nerve will be also there. We will see when we will do the nerve supply. If you see this diagram, facial nerve is coming. This is the facial nerve, sensory branch, facial nerve. That's why we say posterior part will be facial nerve. Clear? Superior part, middle cranial fossa, parotid gland, here temporomandibular joint, facial nerve, and mastoid ear cells. I think it is clear. Clear. Clinical correlation. Why it is important? Because if there is acute mastoiditis, what will happen? The sagging of this area may be noticed. The posterior superior canal wall will be sagged here. Okay, that is the important part. Next thing is tympanic membrane. See, tympanic membrane, what it is? See, this is a tympanic membrane. Tympanic membrane, this is a tympanic membrane, tympanic membrane. Tympanic membrane, what is it? Basically a partition between the external acoustic canal and your middle ear cavity, right? That is the thing. So if we go in more details, it is divided into two parts. This is what are the parts? This is pars tensa, which takes the majority place, and is the pars flaccida. What is pars tensa? Let's talk about pars tensa first. Pars tensa, it basically, I told you, it forms most of the your TM, your trans tympanic membrane, and this pars tensa has a peripheral thickening known as annulus tympanicus. Clear? Annulus tympanicus. And it has a central depression known as umbo. See in this diagram, it has known as umbo. This is the central thickening. Clear? And we have a cone of light also in this cone of light. In the anterior inferior quadrant, we have the cone of light. So if someone draw you this diagram, you can draw this tympanic membrane diagram of pars flaccida membrane. Okay. Oh, I didn't told you this tympanic membrane, how it is present. This tympanic membrane is not straight, okay? It is obliquely present. You can see this obliquely present. And how it is placed? It is placed like this. As posterior superior part is placed laterally and anterior inferior part is placed medially. I repeat again, posterior superior part is placed laterally and anterior inferior part is placed medially. Okay, this is the way it is present in the and height is 9 to 10 millimeter, width is 8 to 9 millimeter, and thickness is 0.1 to 1 millimeter. That's it. Clear. Okay, pars tensa we have already done. Now pars flaccida we were doing. Pars flaccida is basically this part. It is above the lateral process of. Okay, so we were talking about pars flaccida. This pars flaccida is placed above the lateral malleolus. If you see this diagram, this is the lateral process of malleolus. What is malleolus? Is basically the ossicles, malleus, incus, stapes. Okay, I will show you later, but here you can see, let's a brief here. Malleus, this is incus, this is stapes. Malleus had head, neck, and anterior process, lateral process. This is lateral process. Okay, this is the handle. So we will see this. Okay, this is the lateral process of malleus. Okay, this is the handle of malleus. If you see this diagram, you can just correlate with it. This is the tympanic membrane. This is the malleus. It is attaching with this tympanic membrane. So what it is attaching? This is the lateral process of malleus is attaching. Handle of malleus. Okay, clear? Okay, great. Then this we talked about. So pars flaccida, it is above the lateral process of malleus. It is also known as what? It is also known as Shrapnel's membrane. This is important. Okay, Shrapnel's membrane, and it is placed between the notch of Ravenous and the posterior malleolal fold. You can see the pars flaccida is placed between the notch of Ravenous and the posterior malleolal fold. It is also known as Shrapnel's membrane, and it is placed above the lateral process of malleolus. Is it clear? Okay, great. So this is all about the pars flaccida, pars tensa. Now let's talk about the layers of the tympanic membrane. The tympanic membrane has 3 layers. This is the outer epithelial layer, middle fibrous layers, and inner mucosal layer. Outer epithelial layer is basically continuous with the skin of the external acoustic canal. Middle fibrous layer encloses the handle of malleus, contains radial, circular, and parabolic fibers. What does it mean by this? Let's see this diagram. As I told you, this is the handle of malleus, right? And this is the radial, parabolic, and circular fibers. This is the diagram, you can correlate with it, right? This is the middle fibrous layer. It consists of these things. Inner mucosal layer is continuous with the middle ear. Okay, great. And the pars flaccida has not organized into fibers. You can see the diagram also. It has not organized into fibers. Only the pars tensa fibers it is there, right? That is circular, radial, parabolic. Okay, great. Last part is the nerve supply. Okay, nerve supply. Let's see this nerve supply. First of all, let's supply this auricle. We have divided the nerve supply into 3 parts. That is the pinna nerve supply. The next part is your external acoustic canal nerve supply. The next part is your tympanic membrane nerve supply. 3 parts you have divided. Okay, right. Auricle nerve supply. Auricle nerve supply, this part is, first of all, understand this is the lateral surface, this is the medial surface. So outer part of your ear is the lateral surface, inner, this one is the medial surface. Okay, that is attached to your body. Okay, let's talk about it. First is this greater auricular nerve. This greater auricular nerve, it is placed where? It is basically most of the, first of all, it is placed in the most of the medial surface and also on the posterior half of the lateral surface. This is the lateral surface and this is the posterior half. So it is placed in the posterior half of the lateral surface, and most of the medial surface is covered by the greater auricular nerve, that is C2-3. Next thing is your lesser occipital nerve. Lesser occipital nerve is placed in only the upper part of the medial surface. Clear. Then is your auricotemporal nerve. It is placed where? In the tragus. This is the tragus, crus of helix, and your adjacent part of antihelix. Clear, auricotemporal nerve. Then we have green part, medial surface. This is cranial nerve 7, that is your facial nerve, and 10th is your vagus nerve. That is the part. Then the concha and the medial eminence. These are the thing of the pinna. We have done the nerve supply. Let's talk about the external acoustic canal nerve supply. External acoustic canal nerve supply, the anterior wall, this is the anterior wall, green part is supplied by auricotemporal nerve. Auricotemporal nerve. The roof and the anterior wall is supplied by auricotemporal nerve. Then we have the posterior wall and the floor. Floor is supplied by what? Floor is supplied by your auricular branch of vagus nerve. You can see this purple part, and with this purple part you are also seeing that this yellow part is also going. What is this yellow part? This is the facial nerve. So along with the auricular branch of vagus nerve, the facial nerve sensory branch is also going along with it. Facial nerve is also going along with it. It's clear, right? Roof, auriculotemporal, floor, auricular vagus nerve with the sensory nerve. One important sign here, it is known as Hitzelsberg sign. Which sign? Hirschsprung sign. Okay, Hirschsprung sign. What this sign is? It basically when there is congenital cholesteatoma. Congenital cholesteatoma means when there is a skin rapid multiplication happens and it blocks the area. What will happen? The facial nerve is here, so it can lead to facial nerve palsy on the same side. For example, if the right ear Hirschsprung sign is there, congenital cholesteatoma is there, what will happen? The right side facial weakness will happen. That is the thing. Okay, clear. This is the thing. And herpes virus also affects this thing. Herpes zoster. Let's say the last part is the tympanic membrane nerve supply. Anterior half we can see it is supplied with green part, that is known as lateral surface known as auricotemporal, and posterior half is supplied with auricular branch of vagus nerve, and the medial surface is also there. Medial surface we can't see, that is supplied by tympanic branch of glossopharyngeal nerve, that is cranial nerve 9, also known as Jacobson nerve. Jacobson nerve. Okay, this is important. That's it. This is the nerve supplies of the all thing we have done. The nerve supply, this is written as same thing I have told you. Now the height, external acoustic at 624 millimeter, outer is cartilage itna, bone itna, furnicles is out. This we have done in easy way. We have completed the external ear. Okay, so just go through the Dhingra book and you will be able to easy. And I have this notes completed for you. Okay, done. Next we will go to the next part, that is the middle ear. Thank you.